Yeah. So hi. You
Hi.
recording me?
Yeah, just I got sisters and brothers and
Yeah.
stuff.
No
You might
worries.
as well.
That's fine. um, so just for your sisters, I'm Zach. I'm a PA. I'm with the cardiology team here at IMG. So
Will you be the person to carry when I leave?
one of them.
Okay.
Yeah, one of them for sure.
Okay.
So you came in. You had the shortness of breath.
Yeah.
Volume overload. You had the enzymes that were basically suggesting that you had extra fluid on.
Yes. I
Even though
was
you
supposed to be
didn't
20.
look like it, you had a little bit of stuff here, and so couple things going on. Your CT notes that you've got some calcifications of your coronary arteries. That doesn't mean that they're blocked, but we should definitely investigate it in the context of the ultrasound findings, which is what I'm going to talk about now. So normal pump function for an echocardiogram is considered like 50 to 65%. We even consider 50 like low normal. Pump function is basically the ejection fraction. It's the amount of blood squeezed out, divided by the total amount of blood that a chamber can hold.
Okay.
So basically 2/3 of the blood volume is pumped out normally for a beat. Your EF was 25%. So that is 1/3 of the normal amount.
That's the bad news.
That's the bad news.
Does that mean her valves aren't functioning
No,
properly?
good question. Her valves actually looked okay. It means that the myocardium, the muscle tissue itself, is not squeezing as well as it should. So a couple things
Should or could?
as it should and could. I guess both, sorry. A couple things we think about when that happens. If your muscle is not getting enough blood flow, it cannot squeeze as well as it should, right? Think about if you cut off circulation
Yeah.
to your arm.
So
You're not
that's
gonna
her
be able to squeeze it.
dizzy, her all of that kind of stuff, the
The
shortness
shortness
of breath.
could absolutely be attributed to that.
Yeah.
But give me 1 second. I got you. I'm gonna get you
Okay,
a couple
let
of
him
pointers.
talk in the
I
walls
will answer
questions.
every question
Okay,
because this is
okay,
gonna be
yeah.
we're gonna discuss some stuff while we're here now. That way we don't have to spend hours as an outpatient. We
Okay.
can spend 20 minutes and work on the high yield stuff when we see. So the first thing we got to rule out is significant blockage. So per that point, you've got
That's
some
not that catheterization thing
calcifications.
you gotta do.
You're probably going to need a cath, but we could get away with a coronary CTA, which is a special CT angiogram of the heart arteries. However, I will say it's not as sensitive and it's not therapeutic as a heart cath, meaning that it can find the blockage and give me some information on that. But if I find a blockage, one, it might be a little more significant than we anticipate. There's some room for error with the CT compared to a heart cath. The other thing is that if we find one and we want to fix it, I have to do the cath anyway and go in and open things up. And not me, a person would have to do the cath. This is a routine procedure that we do on people all the time. That doesn't mean that there's no risk involved, right? But we try to keep that risk at a minimum. And risk is relative. We're comparing risk of something that's from a procedure to the risk of letting this be and letting it fester and get worse.
You'd have to put me in La La Land to do that.
We can absolutely put you in La La Land, or at least sedate you a little bit and give you something to calm down. Absolutely. We do that all the time. It is not fun being on that end of the cath because it's very stressful. But I will say the only pain you should feel is the pain that you get when we numb you. It's a stinging sensation. We give you the numbing
I watched
medication.
my dad go through it. I understand what a cath is.
Things have changed a little bit since probably when your dad went through it. I will tell you, we're better now. We have smaller wires. We're just better. Okay, we have better technology. Things are evolving as we learn more.
I damn well hope so.
Yeah, me too. So,
You could be on my side. I hope never, but yeah.
I hope I'm never on your side. But in other situations, I've definitely been a patient, and I totally understand what it's like. This is very stressful. I had to undergo like a 6-hour surgery a couple years ago. I had to go completely under. I woke up, had no clue where I was at. It was very stressful, and I couldn't walk afterwards. So I do know that part of at least being like on the receiving end of treatment, and it's pretty stressful.
Well, I just know that you're up for this one. That's what I'm saying. You're going to have to put me in, like, you know.
We're not going to put you completely
I
under.
know,
will
but
tell
I
you
understand
But
that.
we can give you something to absolutely relax you, like anxiolytic medicine.
Well, I'll be
And
here
we'll
for
give
you, Mom.
something to numb you. We'll have a whole team supporting you, and this doesn't have to be done right now. Okay, this can be done in the next week or 2 or 3. It shouldn't go for a week, or a month or 2, but we can get this done as an outpatient.
Well, she's here, so, okay.
So the other thing that we should evaluate are other lab findings, like check your thyroid, check for other markers that may precipitate, that may cause this muscle squeezing issue. But the most common one remains blockages, especially with the calcifications that you had and your family history that you reported to me. I will say her valves look good, and we diuresed, meaning we took some fluid off of her and she responded really well, and it looks like her right ventricle is much better and her filling pressures are better. So she definitely did well. And she might be somebody who doesn't really need that much diuretic and medications as an outpatient. So leading to my second point. Just because we go in there and we look for a blockage and we fix it does not automatically mean that it's just going to correct itself immediately. It takes some time. So usually what we do is we initiate certain medications that are protective for complications related to heart failure. It can keep the fluid off, and that long term can help improve the pump function of the heart because, like I said, it doesn't always just fix itself. So a couple of these medicines, one I think you might have pulled, the metoprolol. Yep. So the metoprolol we're going to give you, that is a beta blocker. It's going to try to slow the heart rate down a little bit and make the heart a little more efficient per squeeze in the long run. So the other thing is you were taking, I think, losartan as an outpatient, right?
That was my blood pressure medicine.
Yeah, totally. So the nice thing about losartan is I can keep that one because it actually has a protective effect long term, and it's a good medicine. It's one of the 4 medicines that we give people with heart failure. So to circle back, you have 2 diagnoses right now. You have a cardiomyopathy, which basically just means a heart muscle tissue issue. Is it not getting enough blood flow? Is it inflamed, or is something else going on? Do you have, there's other stuff that we'll talk about. We can go through all of it once we get more testing. But the other thing is that because of that pump function, you now have heart failure. That does not mean that it's like not working at all. It just means that it's impaired. Mm-hmm. It's not working as well as it should. I'm going to help that out with medicines. And I have people that, once we identify a cause, fix the cause or address the cause at least, and then start medications, they do really well. Their pump function comes back up, and they can even recover completely from this. And you'll be somebody that has a diagnosis of a previous heart failure or previous cardiomyopathy. But if we don't identify the cause, we can't fix it. I'm just band-aiding it at that point.
I don't want you to do that. I want you to
Of course.
identify the
Sorry,
cause.
I poked my eye earlier. It's
Sorry.
bugging me. The other thing is that you're having a lot of extra beats on your rhythm strip, your telemetry, this thing.
Mm-hmm.
So could that be because your pump function's low? Maybe. Could it be that because of the blockages? I don't know. Could it be that that's driving the pump function issue? I don't know. It's kind of like a chicken or the egg thing. Did the pump function issue cause the low beats, or did the low beats cause the pump function issue? So that's another thing that's a possible issue that we should evaluate.
Okay.
The metoprolol will also help suppress those beats. As an outpatient, you should get a monitor for at least 2 weeks, I would recommend, just to get a good idea, like 10 days basically, of the burden of extra beats.
Okay.
If there are certain frequency, usually over 10%, that can absolutely be contributing to your pump function issues.
Could that be stress-induced, those extra pump functions?
Stress can certainly make them worse, but I don't think it's the primary driver of this.
But it could exacerbate the issue.
Exactly. Not as much as we're seeing on the telemetry, I will tell you that.
Okay.
It's strongly suggestive of something else going on.
Okay.
Some people have abnormal electrical conduction, which causes that. Some people have had old heart attacks that we don't know about, or maybe aging of the heart tissue that causes scar, and the conduction is abnormal.
Okay.
Think of it like traveling over a bumpy road. It just doesn't work as well as it should. And then some people, it's actually from blockages that are actively getting worse. So, does all that make sense?
It's making sense.
So you are not crazy. You never were. But you're not crazy. Your shortness of breath is absolutely due to this. Okay? You don't have a clot in your lungs. You may have blockages in your arteries that are getting worse. I don't know until we get a look. But we'll
what
do
about
all the
exercise?
things.
You're giving me that. What?
You should take it easy right now. So just
I can walk the dog.
you can walk the dog, but if you start to get symptoms, you just need to go sit down.
Walk the dog by herself in the heat,
Okay.
that's not a good
Yeah,
idea.
definitely not that.
So like what he's meaning is like now in the summertime, it's 90 degrees. That's a no-go for you. No go.
I hear
Until
you.
And I
we
got
get
it
a
on video
definitive-
for your daughters and everybody
I
else.
hear you all.
Until we
Okay.
get a definitive answer for the blockage, you should proceed with caution on almost everything that you do right now, because we don't know what's brewing in there. And it's likely that some of the medicines that we send you home, I won't say likely, it's possible that some of the medicines that we send you home on might not be enough to keep the fluid off. It'll help, certainly, but you're gonna have to watch and make sure that you don't feel that shortness of breath getting
As
worse.
soon as I do, I'm going to pick up the phone and call you and say,
That's what we're here for. So I think the other thing is that if you develop chest pain at all, that's something, if it persists and it doesn't go away and it's out of proportion to, what you're doing, doesn't get better with rest, you need to go to the ER.
Well,
because
she's not going
it's
to be
like
doing
that.
anything right
Good.
now.
Perfect.
And then diet, as far as, is there anything with her diet we should watch out for?
We call it like a cardiac healthy diet. She should just stay low on the salt.
Okay.
Water's okay, actually, I think.
She does really good on water, I would
Sick
say that.
for 64 fluid ounces.
Okay.
Like 1.5 to 2 liters a day
I
should
just
be
like
okay.
sugar. That's all.
You like sugar?
Yeah,
Yes.
I'm a sugaraholic.
Are you diabetic?
No.
Okay. Oh, you're
Well, she
lucky.
does love her sugar. I
Okay,
mean, I
well,
brought her cookies. I
you
mean,
know,
sorry.
Sugar's fine. I don't want you to be miserable, but just keep in mind that the
Salt
more
is-
salt and the more, even not salting your food, you got to keep in mind that processed foods like McDonald's, Chinese, I love Chinese.
Sorry, I brought her some,
Italian,
but
yeah, all these
Italian.
heavy salt,
so more
um,
cooking at home, low salt,
low
low.
sodium. Do
Okay.
not add any salt to your diet right now.
Okay.
Okay.
Because your pump function is such that any small insult. So here's how it works: you drink, you take in extra salt, then you get thirsty because your body says, "Oh my, we have to keep a
We're just
balance."
adding more liquid to the already pump that's trying to pump my.
Exactly. You
I'm
got it.
really, I'm hearing everything you say.
Beautiful.
What
Okay.
is slim and salad?
Oh, I got it all right
That's
here, so we can
honestly-
replay it if you need to hear it
Oh,
again.
sure, I'll hear from all of you.
All I got.
You're
Thank you.
amazing.
You are
Thank
awesome.
you.
Now, where's your
Thanks.
offices?